From the Cronkite studios in downtown Phoenix, this is Cronkite News.
Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Veronica Graff. Tonight, we take a look back at top stories from our health reporting team, from how soon-to-be doctors are learning about alternative treatments for pain, to how yoga is helping students with discipline problems.
The Arizona Department of Health Services is working to combat the opioid epidemic across the state, taking new measures to find solutions.
Cronkite News reporter Bryce Newberry joins us live with a look at the progress so far.
Imani Eliav, the state recently released a report about the progress made in 2018. We've been digging into the numbers, and these are some of the big ones. 1,375 suspected overdose deaths in Arizona in 2018, and 9,335 suspected overdoses last year. Now, 91% of those deaths were right here in Maricopa County. One way, of course, to stop an opioid overdose is with naloxone. Pharmacists in Arizona dispensed nearly 28,000 doses in 2018. And a couple of other stats that are interesting. 35% of people who had a suspected overdose were prescribed by 10 or more providers, and 26% of those people who had a suspected overdose last year had 20 or more prescriptions filled. This morning, we sat down with the state health department's leader of the opioid epidemic response. It turns out only about 38% of prescribers are following state law to check the state's controlled substances prescription monitoring system before prescribing opioids. But the state health department's assistant director says Arizona is a leader nationally in terms of responding to the epidemic.
The response that we put forward was a significant leap forward with a substantial amount of action occurring in a short period of time.
The state has come up with several solutions, like a hotline for people struggling with opioid addiction and increased access to naloxone.
Our efforts have been tremendous. We mustn't let up on that effort at all. We still are seeing an increase in overdoses and deaths, and that may be the case, unfortunately, for a while yet.
But for now, another element of the state's response is a curriculum for Arizona medical students.
This is landmark curriculum.
The state included schools across Arizona to create the curriculum, including Charlotte Thrall from ASU's College of Nursing and Health Innovation.
The goals were to effectively equip our students when they graduate to be able to appropriately treat acute and chronic pain issues, as well as treat substance use disorder. This is a crisis that our graduate students need to be prepared to intervene in.
Jessica Wagner is one of those students.
It goes back to the basics, like let's try ibuprofen, let's try Tylenol first, let's try physical therapy, let's try like biofeedback, let's try acupuncture.
Those basics are skills she plans to take into her career.
Graduating in 2019 as a prescriber and provider, I think I have a fresh view, fresh eyes on the opioid crisis, but coming out with an entirely new view and perspective on addiction and pain, I think is hugely beneficial.
The state held a curriculum training for medical school faculties late last year and plans to create a continuing education version of the same curriculum for professionals. Live in the Broadcast Center, Bryce Newberry, Cronkite News.
Today is National Healthcare Decisions Day. It's a day to promote advanced directives or written plans for end-of-life care.
They're forms people fill out so that doctors can know how a patient would like to be cared for, especially in emergencies.
Cronkite News reporter Jennifer Alvarez talked to a son of a patient who has advanced directives in place and found out why he believes these are so important.
My mom's going to be 94 next month. Her name is Teresa. She was diagnosed with diabetes about 35 years ago. My mom had 2 sets of twins. I'm the second of the second set.
This twin's name is Timothy Biagas, and he realized the importance of advanced directives after a social worker at his mother's hospital asked him about it.
She spoke with us, and she asked me if we have one in place. And I was like, no, do we need one? So she presented the information to my mother, and she was like, no, I don't want to do this.
But he was eventually able to convince her.
We're just making sure that we have the documents. which would help you get your message across when you can't.
There are two common types of advance directives.
Medical power of attorney, which would be the person who would help make decisions for you if you can't make them for yourself. And then another common one is called a living will, a document that lays out what wishes you might have, particularly if you are terminally ill.
And they say having these forms in place relieves stress.
It gives me peace of mind and my wife peace of mind that, at least we know that we'll be able to take care of Mom the way she wants.
During those really, really emotional times, we can then help that family with that conversation because we already know what that patient would want.
According to a study by Health Affairs, only about a third of adults have an advance directive in place. But Dr. Mayer says it's important for everyone.
It's not just older people, it's not just people who have cancer, not just people who are sick. My kids are in their 20s. They know what a medical power of attorney is, because what if they get hit by a bus?
And while these conversations may be hard to have, Biagas says,
just let them know you come from a place of loving, and care.
In Gilbert, Jennifer Alvarez, Cronkite News.
If you do not have an advance directive in place for yourself, doctors have to consult whoever state law says to go to.
And doctors say this person may not always be the person who knows you best, which is why they stress that their patients should get these forms filled out.
Up first tonight, a Cronkite News special report on vaccination rates here in Arizona.
This comes at a time where the number of measles cases across the country is the highest on record since the disease was declared eliminated nationwide back in 2020. Analysis of data from state and local health departments reveals 681 cases of measles have been reported across 22 states this year, including here in Arizona. Previously, the highest number of reported cases in a single year was 667 back in 2014. The Centers for Disease Control and Prevention says most of these cases are appearing in areas that have low vaccination rates. In our state, health officials warn the coverage rate has dropped so low that an outbreak of measles and other vaccine-preventable diseases may rise.
Cronkite News analysis of data from the Arizona Department of Health Services shows these hot zones for low vaccinations among children in kindergarten. Maricopa County is the most populous county in the state, and its current vaccination rate is near 93%. Mojave County has the largest decrease in immunizations, dropping 3.7% in just the past year. The most at-risk county is Yavapai County with just an 83.3% vaccination rate. Cronkite News reporter Jennifer Alvarez traveled there to find out why this area in Arizona is heavily choosing to opt out of vaccinations and what the county's doing in response.
Health experts in Yavapai County say it all comes down to one thing: trust. They say many people in Yavapai County just don't trust vaccinations or the information and people behind them. Open roads, grassy fields, and natural landscapes are what many say make Yavapai County a peaceful place to live. It also has the highest vaccine exemption rates in Arizona.
Personal exemptions are used at a higher rate in our community,
which experts say leave community safety at risk.
If we were to, say, see measles spread in Arizona, Yavapai County is very susceptible and at risk for it spreading rapidly.
But why do people in this community choose to opt out of vaccines? Yavapai County experts say it's all about trust.
We have people who live in our county in kind of off the grid because they like being in a rural area where there's not a lot of government intervention. There's a segment of the population who feel that they want to live outside of government controls, and they see vaccination as a government mandate or control. Things injected into their bodies that they don't fully understand or know what's in there. And so I think that there's some varying vantage points of mistrust.
And health experts say this mistrust can have major consequences to what they call herd immunity.
We need to have 95% vaccination rates in the entire community. And if you do that, the people that can't get vaccinated because of a medical condition and babies less than 1 who can't get vaccinated for MMR yet are still protected because we have herd immunity. But what we've seen over the last 10 years is an erosion in those vaccination rates. And so when somebody comes from another part of the world with a disease like measles, there's plenty of other people to infect.
Yavapai County does not meet herd immunity rates, so the county is doing what they can to get there.
We do a lot of outreach efforts, and so we know that some people were never going to change their mindset on how they choose to immunize their children, but our nurses really work with each parent that we see.
A lot of doctors are, pretty stringent on the CDC recommendations and their schedules, but, at the county, there are people that just want to wait because they feel like too many vaccines for little babies is a lot, and so our nurses will work with them on a delayed schedule if they'd like.
But still, they recognize that legally, vaccinations in Arizona are a choice.
So we definitely advocate for them, but we also understand people's personal beliefs and, realize that we can't change everyone's mind or we can't convince them all.
And more parents, not just in Yavapai County, aren't convinced.
I don't trust the numbers, I don't trust what they're saying, it doesn't scare me.
Measles don't scare her either.
To me, that's nothing that I'm super worried about. My dad had them, my mom had them.
It's one of the most volatile medical, family, and community debates of 2019, whether parents should vaccinate their children.
Somebody isn't vaccinating, and that makes me angry.
I don't want 1 ounce of that injected to my children.
Why would you ever put your child at that risk? Why would you put someone else's child at risk?
If you believe that vaccine is so powerful and so strong, then why do you care if my kid is vaccinated or not?
Heather Wolcott's opposition to vaccines goes as far back as giving birth.
I did not want to have my babies in hospitals. I didn't want to go in there at all because I didn't want to vaccinate. I didn't want to be pressured into vaccinating.
And she believes vaccines risk more harm than good.
The chemicals in the vaccine alone scares me to death. To inject that into my healthy kids, to me it's like Russian roulette. Like you just don't know what you're getting. And that to me is way more threatening than my kids getting the measles.
Other parents are strong supporters of vaccinations, like Jacqueline Phillips.
Yes, I love that there's this movement of making good choices for your children and, directing them to healthier options. Vaccination is a healthy option because the alternative is an illness that can either kill you or debilitate you for life.
She says people who choose not to vaccinate are putting others in harm's way.
I liken anti-vaccination to drunk driving, and this is going to really upset a lot of people, but if you think about it, it's a conscious decision that someone made that creates a level of harm to an unseen population. If you choose not to vaccinate and you become a carrier for that illness, you are a harm to everyone around you and you are an unseen harm.
She says parents need to not only think of their children, but of others as well.
Every parent is going to parent differently, and that's totally fine. But if your child is going to interact with other children, that's when you have to start taking that into consideration.
Still, Wolcott says parents should make the decision best for them.
Every decision you make as a parent matters. Before you put something into another human being that you're responsible for, you need to know what it is. If they're not going to read the ingredients and question and challenge what's being injected into their child, that is completely their choice.
Parents on both sides can agree on one thing, whether they vaccinate or not, that they're doing what they believe is best for their children. But health officials do say that choosing to not vaccinate can have bigger repercussions to herd immunity overall. Cronkite News reporter Veronica Graff explains.
This is how herd immunity works. When the majority of a community is immunized, it protects even those who cannot be vaccinated for medical reasons. The threshold for immunity varies because some diseases spread more easily than others. Health officials are concerned because vaccination rates have fallen below that threshold in some areas. This can leave communities at risk for outbreaks. Experts say measles is extremely contagious, so 95% of the population must be vaccinated for herd immunity to work.
Fecal transplants that have helped people with illnesses may also help those with autism. One Gilbert boy participated in research hoping for help. Cronkite News reporter Ashley Carter shows what treatment meant to the teen and his family and what it could do for others.
Before Ben Bonarati began treatment, he scored a 107 out of 180 on the Autism Treatment Evaluation Checklist, according to his mother.
5 years after completing the study, his score is now a 3. His family credits his progress to microbiota transfer therapy. Ben Bonarati enjoys riding his bicycle with his friends, wrestling, drawing, and painting.
And this is a polar bear.
According to Ben's mother, 5 years ago, Ben had a very different life. They made many attempts to heal autism symptoms like repetitive movements and gastrointestinal issues.
He still had a lot of what we call stimming. So he had hand flapping, he had visual stems where he would seek out visual input. He would have meltdowns from various auditory stimuli. He had explosive diarrhea still. He was wetting the bed. His belly bloating was still there.
After being referred to Dr. James Adams for a research study, the family embarked on a journey that would change Ben's life.
We take gut bacteria from the stool of very healthy people, very carefully screened, purify that gut bacteria to make it just like a probiotic, but instead of having one or a few strains, it has 1,000 strains, those from very healthy people. They swallow it, and they take it daily for 8 weeks.
After reaching out to families whose children participated in the study, researchers found about a 60% reduction in gut problems and 45% reduction in autism symptoms.
What we think is happening is that by healing their gut, now their brain is in better condition. It's a healthier brain, and now it can learn language, learn social skills, learn behavior, so as kids can start catching up to their peers.
The change in Ben was striking.
The visual stimming was gone. We didn't see any of this. We still don't see. So basically all of his autistic symptoms and behaviors are non-existent.
Now 15 years old, Ben is working on his expressive language skills and has big dreams for his future.
I want to be a doctor.
Adams says his daughter, who was diagnosed with autism, inspires him to pursue new ways to treat autism. This team is working on another research phase, this time involving adults. He hopes the treatment eventually will become available to the public. In the Broadcast Center, Ashley Carter, Cronkite News.
Waiting in emergency rooms can last for several hours. One hospital is renovating their emergency department to better serve patients in the West Valley. Alexis Pulick spoke with the medical professionals for an update on emergency room care.
Emergency medicine can largely be seen as an ongoing, real-time needs assessment for the community around that hospital.
Patients may have long wait times because there isn't enough time and staff to treat people quickly.
We will take people and admit them, and often they will stay in the emergency department for 8 to 10 to 12 hours. Psychiatric patients can stay for days, if not weeks, because of the lack of resources on the other end to treat these challenges.
Location also determines service.
You really need to break it down into 3 different parts of the state, urban, rural, and tribal. And those areas each have their own challenge. Across the country, not just in Arizona, it's fairly easy to find emergency physicians willing to work in urban areas, especially desirable urban areas.
However, Banner Boswell Medical Center, as a part of its hospital's renovations, is building a bigger ER department to serve the growing West Valley.
Our current emergency department is not only old, but it only allows us to service about 40,000 patients a year. So this project allows us to expand to 62,000 patient visits a year.
According to Flores, 85% of patient traffic comes from the ER department. The Banner medical staff is preparing to handle the influx.
We're using more and more mid-level providers, so nurse practitioners, allied health providers, and there's a lot of ways that we can actually leverage our providers to be more productive.
Regardless of new hospitals, Arizona needs to improve its overall standard of emergency room care. According to the American Emergency Care Environment Report Card, Arizona gets an F in access to emergency room care.
Long story short, we are able to meet the challenge if we're given sufficient resources, but the challenge is greater than the resources that we face, and we are very resource rich already. We're hoping for most of the team that we need to be there. That's number one. And then number two, we're hoping for the resources out in the community to address the need of the population.
The Banner Boswell Medical Center renovation is expected to be completed next year, coinciding with the hospital's 50th anniversary.
Have you ever had trouble drawing? How about eating a bowl of soup? Essential tremor usually affects individuals in their mid to late 40s, but adolescents and children are also experiencing this disorder.
Madeline Holler spoke to one student who is empowered through his diagnosis.
I've discovered that it helps a lot to press my pencil down harder, and a couple other things that help, like writing grips and pencil weights, but nothing really ever helps fully.
Medical researchers consider essential tremor one of the most common movement disorders worldwide. They say it is more prevalent than Parkinson's or Alzheimer's disease. Mark Lowell, a high school sophomore in Surprise, has struggled with essential tremor since he was a toddler. He was formally diagnosed at age 10. Lowell tackles the progressive disorder through trial and error.
I know that one day I might try to approach things one way, like maybe the way I walk or just the way I talk. But it might not work out. So the next day I'll try another way, and if that works, I'll try and stick with that until my tremors get worse. Then I rethink it all.
Mark's mom, Gia, says she first documented Mark's symptoms by recording him on her cell phone. That helped with his diagnosis. She says she struggles watching him go through so many therapies.
He had one drug that caused a complete personality change and caused me to be depressed and angry, and it was scary, and I didn't even notice until it was so bad. Then he had another drug that lowered his blood pressure so much that he was passing out once while he was on the stairs, and he fell all the way down. Then others don't even work.
Those bad experiences led him to raising awareness for essential tremor.
When he got diagnosed and he found out there was a reason he couldn't do things that everybody else could, he became empowered just immediately.
Through his fundraising efforts at Imagine Prep Surprise, Mark was able to raise $1,403 for the International Essential Tremor Foundation, which also garnered support from around the world on Facebook. This moment helped Mark believe his tremors do not define his ability to make a change in his community.
It was pretty awesome. For a lot of my life, this has been something that I've had to face by myself. And this entire experience has made me feel like I'm not alone.
In Surprise, Madeline Holler, Cronkite News.
While there is no known cure for essential tremor, medical professionals, therapists, and support groups are playing a large role in supporting those to live a happy and healthy life.
Additional resources can be found from the International Essential Tremor Foundation.
The first new light rail stop built with funds from Transportation 2050 funding is set to open tomorrow. As Nicole Hernandez reports, the station is different than any other stop in the city.
The first train is arriving at this brand new light rail stop near 50th Street in Washington.
I'm really excited.
Excited for a much shorter commute.
I travel from 19th Avenue and Camelback, and I get off at 44th Street in Washington. Then I have to drive a mile to work every day that I work.
Tony Jackson drives that mile in his powered wheelchair.
I was born with arthrogryposis. It's a congenital disease, which means it was from birth. Where my joints are affected. So my joints a lot of them are fused together, and I have a limited range of motion.
The new stop is just feet from Ability 360 and features a platform that is more ADA accessible than any other stop.
The platform is wider. Two people that use wheelchairs can pass each other. It has the photo detection at the stop lights, so that if you enter the area of the stoplight, it's going to automatically detect that you want to cross the street. And of course, the shading.
All things most riders might not notice, but that make a big difference for the Ability 360 community.
It's going to give a lot more access to a lot of people.
In Phoenix, Nicole Hernandez, Cronkite News.
Construction started back in 2017 for this stop and cost almost $23 million to build.
School is filled with memories of recess for many, but now one teacher at Levine Elementary has introduced a new option, yoga. Blaine McCormick explains.
I was pretty judgmental about diving into yoga because all I thought it was just postures and poses.
But now Gavin Tucker is teaching it at Levine Elementary School. Along with instructors, Tucker introduced complementary yoga with the school's curriculum and disciplinary policies. The school has seen a 70% reduction in office referrals, according to Principal Robert Kaplinger. There are morning sessions in the school's gymnasium, as well as a private room titled the Mind, Body, and Spirit Room, or MBS for short.
Kids are eager to come to school because they know that there's going to be yoga, they're learning something new, and they've embraced that.
When you walk down the hallways at Levine Elementary, you come to this door, which is the MBS room. And when they walk in the room, a yoga mat awaits them, along with beautiful scenery to help them relax. There's also essential oils and smells with diffusers in the room as well. So the students take off their shoes, get down on the mat, and are ready to be taught breathing and yoga techniques by Gavin's wife, Jackie.
All the kids that I'm seeing right now have either been struggling from anxiety, some kids just having a hard time focusing in class. And so when they have, come to see me, it's just been like a completely turnaround. The transition has been great. They came in struggling and now they're able to deal with things using their breath.
Outside of school, Jackie is a certified yoga instructor in the Valley. The program has been used through elementary and middle school grades, along with special education.
For half moon, deep breath here.
In my classroom, it's had a really positive calming effect, and we're always looking for new interventions for our kids. We're always trying something different and new, and this program has really taught my kids to stop and focus.
Tucker said that he wants to keep developing the program and eventually take it to the school district.
During these yoga sessions, parents are welcome to participate in the exercises along with their children.
That's it for this special edition of Cronkite News tonight. Thanks for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.